60 years. Now, obviously, that's a huge improvement from the initial situation where the average was 50. But we've introduced some inequality in outcomes.
Mm-hmm.
Now, what I'm getting at here, and what the professor was getting at, is fundamentally our moral calculation of what we prefer and by how much. By that I mean how much efficiency being total average outcomes, are we willing to give up for more equality, right? It's efficiency versus equality, and this is a simplified argument, but I think it gets to the core of some of the moral questions that we're tackling here. So, if I gave you the choice of the 55 years, 65 years with an average of 60 outcome versus a, say, 56 years and 60 years with a 58-year average outcome, which would you prefer? So just so we're straight on the numbers here, the first scenario, East Coasters live for 55 years, West Coasters live for 65. The average between them is 60, but there's a 10-year gap between the two. So West Coasters are obviously living longer. In the second scenario, East Coasters live for 56 years, West Coasters for 60, and the average is 58, but the gap is only 4 years, so it's much more equal.
Okay. So let me talk around this to begin with, and then I'll boil it down to what I think.
And you can say neither if you want.
Okay. So there's a central mantra in medicine, which is enshrined in the Hippocratic Oath, which is first do no harm. So now one of the important issues that we're talking about is what to do post hoc versus a priori, right? In the post hoc situation, let's say I come to a society, right, and I'm ignorant, I'm born into a society that is unjust. We have the 55-65 situation, right? It wouldn't be right for me, in my mind, right, given that from the ethics I'm going to appeal to now, to somehow take away from the 65 and give to the 55, right?
Yeah.
That wouldn't be right, because I don't want to harm the health of a group, right, who's in a particular situation. I think hurting people, right, is never the goal.
Yeah.
Now, a priori, if I'm the policymaker and I'm enacting a policy, and this is what I see the policy is going to do, right?
You're at the 50-50 stage.
I'm at the 50-50 stage. Obviously, I care more that our outcomes maybe get better in a smaller way, right? But are fundamentally more equitable, right? So I'm weighing equity over efficiency here. A priori, because at the end of the day, what happens is there's a lot of work that's shown that inequality itself has a lot of negative inequalities in health themselves, right? Have a lot of negative externalities in the society.
Okay. Interesting.
And fundamentally, I would be doing an injustice to the people to whom I didn't attribute the resources, whose outcomes wouldn't have been as good. Is that clear?
Yeah.
So it would be most unjust to remove, quote-unquote, health from one group to give to another. Right, I would suggest that the goal now is to focus on the group who doesn't have quality outcomes.
Right, so the first scenario is just killing your neighbor's cows so that both of you have no cows.
Right, that's not fair.
Right.
Or even my neighbor has 2 cows and I take one of his and I give it to the other one.
Right.
I don't think that's unfair. I don't think that's fair. I think the goal then is to make sure that the other neighbor can get 2 cows. Right, before I give the neighbor a third cow.
Right.
But in the a priori situation, right, it would be unjust of me to create inequalities in the society or to attempt to, obviously this is assuming perfect information about what the future holds, right? But to create injustice in a society by creating inequalities in that society. So even if I'm limiting the potential gains of one group for the gains of another, I'm okay with that, given that I'm not creating the injustice of inequality in that group.
That's interesting. So
the policy relevance here, though, is that we find ourselves in a society where, in depending upon how we call our society, whether we're talking about just our particular individual societies or the globe as a society, we find ourselves in a place where there are inequalities, right?
Absolutely.
There are inequalities, pretty huge inequalities within societies, and then if we look on the grander scale across societies, there are huge inequalities, right?
Probably like a 50-year gap in life expectancy between the...
Wouldn't be that high, right? But
I don't know. Like Japan is 83.4, and somewhere like
Maybe,
Sierra Leone
yeah.
must be less than 40. I would
Yeah,
imagine.
very, very low.
Hey, I'm not the expert here.
Yeah,
But anyway,
no, that's
let's assume
true.
it's at least 30 years.
We'll say at least 30 or 40 years.
Which
Like,
is
gaps
huge.
which is ginormous.
Huge. That's the difference between whether or not you have grandkids. At least.
Right. Right.
At least.
So it's interesting, though, the important thing to consider about life expectancy is not that the average person
This is a good point, yeah.
is going to live that length and then drop off. It's a bimodal distribution. Normally when you have really, really low life expectancy, it means that a large proportion of the population is dying really, really
So
young.
high infant mortality.
Right. So the argument is that, people will read historical accounts of societies and say, well, the life expectancy was 25 years old. And the argument is, well, how does anybody ever reproduce if they're 25 years old when they die? And it's not that simple. What happens is that a lot of people die at maybe 1, and then another large number die at maybe 5,
Right.
up until between 1 and 5. And then from there, the people who live past 5 years old are likely to live until their 50s, 60s, or 70s.
Right.
So
your individual condition adjusted life expectancy gets dramatically higher once you pass age 1 or 2.
Precisely.
Okay.
Precisely. So the way you'd express that is the life expectancy of somebody who's 15 years old is now 65.
Okay.
Does that make sense?
35.
Instead of 35.
Okay.
Right.
And I would imagine that what's the word? Discrepancy tapers off as you have higher income countries, though, right?
Right. Right. At higher income
mortality
countries,
is lower.
Right. Right. Infant mortality tends to be so.
Okay.
Generally, when you look at like an actuarial table of death, a large proportion of deaths happen between years 0 to 1. Right. In any society, people
Right.
are just more likely to die in that first year. But if you make it past that first year, the number of assaults on your life are, we'll just say, much fewer and less serious.
Yeah.
And then from there, death rises every year until about the 60s, 70s, 80s, and
Yeah.
at that point, very few people are left, and their risks of dying in the next year are incredibly high, which is appropriate given the average lifespan of a human.
Yeah.
Right. And when I say lifespan in this context, I don't mean from an actuarial averages table. I'm talking about just the potential for living, right? Human potential for life.
But so this is a digression, but an interesting one, which I've always been curious about. Is there a natural human lifespan? I mean, because all evidence seems to suggest that the life expectancy in the developed world is increasing, like, I don't know, something like 2 or 3 years every 10 years.
Right.
And can it go on forever? Are there diminishing returns? Or
So there's no way to know because in the era of
right.
science, we've been bounded by what people have actually lived.
Right, and it's only been 200 years since science has been
A real force.
Yeah.
Conceptually, though, there are reasons why there would be a limit. So, for example, there's an argument about telomere length. So a telomere is the last piece of DNA in a particular chromosome, right? And because of the way that DNA replicates, there's a small piece of DNA that's not replicated every time a cell replicates.
Oh.
And so the way that we live, especially cells like in your skin or other particular areas like your gut, for example, are constantly replicating to make new skin or new gut mucosa, right? And so the argument would be that over time, you can only replicate so many times until you actually start losing important cellular material. And the argument is that the way that would actually end up fizzling out is cancer, insofar as you've now replicated a cell which is missing maybe an important feedback mechanism that keeps the cell from continuing to replicate,
Right.
such that you don't produce cancer.
I see.
And that's why generally, the older one gets, their risks of cancer increase precipitously, and we see that descriptively in data that the risks of cancer increase every year. And so among people who are 70s, 80s, risks for cancer are incredibly high. And it's suggested that this telomere length argument might explain that.
So it's sort of a law of large numbers. In the end, the cancerous probability wins out.
Yeah, the cancer's going to get you, right? And that's that would be the boil down of that. So to answer your question, plausibly, we couldn't live forever, just because there are mechanisms that we have yet to address that are naturally occurring that will, at the end of the day, bring about our death.
Unless you find the elixir of life.
The elixir of life, and that just changes everything.
Or the Holy Grail. or maybe they're the same thing. So okay, that was a tangent, but again, I think I've always been fascinated by that concept.
The interesting question though is that biomedicine and bioethics have attempted to deal with this question of what we're actually trying to do. Are we trying to have people live longer, or are we trying to just improve their lives while they're alive? Or are we trying to do something of both, right? So if you were to imagine a table or a graph where the x-axis is time in years and the y-axis is quality of life, it's been posited, right, that what we're attempting to do, right, is have everybody live up until 100 with 100% quality of life, and then just pass away in their sleep, right? So that they're comfortable in their life, right? And then they reach their delimit point and just kind of pass away, right? The problem is that we know life doesn't really work like that. It's kind of a downward trend until death. So the quality of life tends to decrease until it ultimately ends in death, where that quality of life would be zero, right? And there's no life. And what we're attempting to do then in biomedicine is to try and improve quality of life, but then also take everybody out to life expectancy of about 100. Now, it's only a matter of time where 100 potentially is just a number that we picked. And maybe we're saying 110, 120.
Right. 100 could be the new 80.
Exactly. And 80 is the new 60.
True.
And
just to add on to that, I think that's absolutely true, and a puzzle for you guys in health sciences. Well, one thing I read in The Economist, I think last month, was really interesting. They had this notion of the U-curve of happiness in life. Again, any of these subjective measures of well-being are fundamentally biased for a number of different reasons, but taking them at face value, a number of studies have shown that people's reported happiness follows sort of a U shape for whatever reason, and that the variation from the peak to the trough back to the peak is almost as large in magnitude as the variation between someone who is employed and unemployed. Actually larger than that. To me, that's pretty big.
Yeah.
It's pretty significant. And The Economist goes into some pretty interesting hypotheses as to why that might be the case. Midlife crises, you have much more to deal with, kids, etc., a job, and then you get into retirement. I don't know if I buy those social arguments as much as more individual-specific, I don't want to go so far as Jungian, but reaching a certain level of maturity kind of arguments. But that was interesting to me, because that would go a little bit against the assumption that as you get older, you sort of deteriorate. You obviously deteriorate in health, but is it a long deterioration, and is it a linear deterioration, or is it, what's the word, corrected for a little bit by your perception of happiness, your individual perception of your own happiness increasing even as your health deteriorates? Just a hypothesis.
I saw this article, and it's interesting because this is going to bring us back to this question of inequalities in health. Because to me, the argument that jumped off the page was that, so if you think about it, these are population level arguments, right?
Yes.
And if poorer people are more unhappy, right, and poorer people die younger, then it could be that reinflection point is what we see when poorer people end up dying out of the population in question, right? And we start seeing now those people who are living 70s, 80s tend to be higher socioeconomic status.
It's simply
and
a selection effect.
It could be a selection effect.
Interesting.
And so it brings us back into that question of social inequalities a little bit, right? Because it suggests to us that it's possible, right, that when we talk about well-being over the time of one's life, right, we're actually just seeing that the people who are most likely to have worse well-being are also most likely to die earliest. And so, it could be a little bit of a... I don't know if I haven't read any of the studies in question. I've been meaning to go into that literature to see if they've tried to address this question.
But that's an interesting...
or adjust it even for socioeconomic status.
Yeah, that's an interesting thought, though, because that seems entirely plausible.
Yeah.
By the way, among all the countries surveyed, the Bulgarians seem to be the unhappiest. I don't
Really?
know why. Yeah.
I mean, I'd be kind of unhappy if I lived in Bulgaria. I'm not gonna lie. No offense to any Bulgarians.
Hopefully we don't have too many Bulgarian listeners. Okay. I wanted to bring this back to, two things. One, I want to ask you, I want to push you a little bit to answer the question earlier on the on the inequality aversion versus efficiency point. So which would you prefer between a 55-65 world